A 72-year-old patient once sat across from me and said, "Dr. Nerita, I've been doing it the same way for 50 years, but lately something feels wrong." He wasn't sick. He wasn't on new medication. But what was quietly harming his health, his heart, his prostate, even his ability to feel was the way he was masturbating. Not the act itself, but how he was doing it. And like so many older men, he had no idea it was slowly damaging his body. I'm Dr. Nerita, a urologist with over 12 years of experience helping men over 60 maintain strength, circulation, and confidence without shame, pills, or confusion. You've been told masturbation is healthy, and it can be when done right. But after 60, certain private habits can quietly become harmful without a single warning sign. In this video, I'll reveal the 7 masturbation mistakes older men make and how to fix them before they affect your energy, your performance, or your long-term health. And trust me, mistake number 6 is the one almost every man gets wrong. Let's get started. Before we dive in, take a second to subscribe and turn on the bell. I share real medical insights for men over 60 every week. And in the comments, tell me where are you watching from. I always love seeing our community from around the world. Now, let's start with the first mistake, one that silently reshapes how your brain and body experience pleasure. Mistake 1. Using porn as the primary stimulus. Over the years, I've had countless men in their late 60s and 70s come to me with the same quiet confession. "Doc, I can't feel much anymore, and I don't know why." They're not broken. They're overstimulated. You see, after 60, your brain's dopamine system, the system responsible for pleasure, motivation, and satisfaction, becomes less. Clip after clip, novelty after novelty, your brain adapts by numbing itself. So even if your body is healthy, your brain stops responding the way it used to. Real touch starts to feel dull. Intimacy feels distant. Pleasure becomes mechanical. And what's worse, most men think it's just getting older. It's not. It's dopamine fatigue. Your brain's way of saying, "I can't keep up with this level of artificial excitement." If you've noticed that your sensitivity or interest has faded, this may be why. The fix: reset your brain. Take a 14-day break from visual stimulation. Relearn pleasure through touch, through breath, through presence. Let your body remember what natural arousal feels like, not the endless scroll of dopamine overload. And speaking of habits that seem harmless, but aren't, the next mistake is about where many older men do it. Mistake 2. Masturbating while sitting on the toilet. I know it sounds harmless, even convenient. For many older men, the bathroom becomes their most private space. The door locks, no interruptions, a place that feels safe. But here's the hidden danger. That position, hunched forward, sitting for long periods, restricts blood flow to your pelvic region. And after 60, circulation is everything. Blood flow supports your prostate, your erection strength, and even your bladder function. But when you compress those arteries and nerves, especially while stimulating yourself, you quietly damage the very systems that keep you healthy. I've seen it in my clinic again and again. Men who develop groin aches, weak flow, dribbling after urination, or pelvic tension, and never realize it started from sitting too long in that posture. Your pelvic region needs space and movement to stay healthy. So next time, avoid sitting or hunching over. Try standing, reclining, or even lying down. Give your body room to breathe. Your prostate will and if that one surprised you, the next mistake is even more common, and it's not about position, it's about pace. Mistake 3. Rushing the experience. One of the most harmful habits I see, especially in older men, is treating self-pleasure like a chore. Let's just get it over with. I hear it all the time. But when you rush, you send your nervous system the wrong message. Your heart rate spikes too quickly. Blood vessels constrict. Your body doesn't enter the calm, oxytocin-rich state that releases healing hormones and boosts mood. You may climax, but your body doesn't receive the true benefit of release. Instead of feeling satisfied, you feel drained. Instead of energized, you feel empty. And over time, that pattern rewires your brain. Pleasure becomes shallow and disconnected. You lose sensitivity, stamina, and interest. The fix: slow down. Let each moment be intentional. Your nervous system now thrives on calm stimulation, not fast tension. There's no finish line anymore, only connection. And speaking of connection, the next mistake involves a part of your body that most men completely overlook. Yet, it's responsible for everything from control to confidence. Mistake 4. Ignoring the pelvic floor. Most men have never heard of their pelvic floor, but it's one of the most crucial muscle groups in your entire body, especially as you age. It sits beneath your bladder, prostate, and sexual organs. It controls everything from erection strength to bladder control. When it weakens, everything above it suffers. I once treated a 68-year-old man, a retired firefighter. He exercised daily and ate well, but he couldn't understand why his sexual function was fading. The culprit, a weak pelvic floor. Years of sitting, stress, and disconnection from that area had caused his foundation to deteriorate. And when you masturbate without engaging those muscles, or worse, by pushing down, that's why some men experience post-duration dribbling, weaker erections, or reduced sensation. The solution? Pelvic floor activation. Try this. During arousal, gently contract the same muscles you'd use to stop urinating midstream. Hold for a few seconds, then release. This builds awareness, tone, and circulation. With consistency, it can restore both control and confidence. And that brings us to a question many men quietly wonder about. How often is too often or not enough? Mistake 5. Getting frequency wrong. Too high or too low. This topic makes many men uncomfortable. Some worry they're doing it too often. Others feel they've gone too long without. Here's the truth. Both extremes can harm your balance. Too frequent, and your prostate can become irritated. Your energy dips. Your recovery slows. Pleasure becomes routine instead of renewal. Too infrequent, and you risk stagnation, poor blood flow, nerve dullness, even atrophy from disuse. The body was designed for rhythm, not extremes. In my experience, for most men over 60, 1-2 times per week is the sweet spot, done with awareness and intention. That rhythm maintains hormonal balance, keeps blood flowing, and prevents both stagnation and fatigue. This isn't about rules. It's about listening to your body. Because at this age, your body speaks quietly, and your job is to hear it. But even if your frequency is perfect, one mistake can still silently undo everything. And that's the next one. The one most men never suspect. Mistake 6. Using too much pressure or force. This is one of the most damaging yet overlooked habits among older men. When sensitivity decreases with age, the natural response is to press harder, grip tighter, or use rougher surfaces. I've seen men who slowly lost feeling not from age, but from trauma caused by too much friction. Force doesn't bring feeling back. It destroys it over time. This also rewires your brain. Pleasure becomes something you fight for instead of relax into. And that tension blocks the very circulation and hormones that create satisfaction. So, be gentler. Your body responds to patience and care, not punishment. And that leads us to the final mistake, the one that isn't physical at all, but emotional. And it might be the most powerful of all. Mistake 7. Masturbating without emotion, connection, or intention. This one breaks my heart the most. Over time, many older men stop feeling connected during self-pleasure. It becomes mechanical routine, quiet, joyless. They're not doing it for pleasure anymore. They're doing it out of habit or loneliness. But when masturbation loses emotion, it also loses its healing potential. Your brain stops releasing oxytocin, the connection hormone that eases anxiety and builds happiness. Dopamine no longer replenishes motivation. You might climax but feel empty right after. That's not age. That's disconnection. Even solo touch can be sacred. It can be a moment of gratitude, a way to reconnect with your body, your breath, your vitality. Touch yourself not to escape, but to reconnect, not for release, but for renewal. Your body is still yours. It still feels. It still matters. And when you bring emotion and mindfulness back into that space, your entire nervous system heals in ways medicine can't measure. Now that we've covered the 7 mistakes, let's bring it all together into simple, practical steps. Cut down visual overstimulation. Focus on sensation and imagination instead of screens. Change your environment. Avoid the toilet. Use a relaxed, reclined position. Find your natural frequency. 1-2 times per week, mindfully done, supports prostate and hormonal health. Use gentle touch. Always prioritize blood flow and comfort, not force. Reintroduce emotion, gratitude, breath, and connection are the most powerful performance enhancers. If you've made it this far, I want to speak to you not just as a doctor, but as a woman who spent 12 years listening to good men struggle silently. You are not broken. You are not past your prime. You are simply evolving. Your body is asking for a new kind of attention, one built on awareness, not habit. And when you give it that, everything changes. Pleasure returns, confidence returns, and connection with yourself or a partner begins to feel alive again. Aging is not the end of vitality. It's a shift in how you relate to your body. So, slow down. Be curious again. Your body is still speaking. You just have to listen. If this video helped you, give it a like and share it with another man who needs to hear this message. And don't forget to subscribe. I'm Dr. Nerita, and every week I share real medical insights to help you live stronger, longer, and more connected at any age. Because your best years aren't behind you. They're right here in how you choose to care for yourself. I remember a 72-year-old gentleman sitting across from me once, and he said, Dr. Nerita, I've been doing things the same way for half a century, but lately something just feels off. He wasn't ill or anything. It wasn't like he'd started taking any new medications. What was subtly impacting his well-being, his heart health, his prostate, even his capacity for physical sensation, was the manner in which he was pleasuring himself. Not the act of masturbation itself, mind you, but the way he was going about it. And just like so many other men his age, he had absolutely no clue. I'm a urologist, and I've spent over a decade helping men over the age of 60 maintain their strength, keep their circulation flowing smoothly, and feel confident without resorting to any embarrassing conversations, relying on pills, or getting bogged down in confusing medical jargon. You've probably heard that masturbation is good for you, and that's true, as long as you're doing it correctly. But once you pass 60, some of your more intimate habits can quietly become detrimental without so much as a single red flag. In this video, I'm going to break down the 7 most common self-pleasure mistakes I see older men making and show you how to correct them before they start to negatively affect your energy levels, your performance, or your long-term health. And believe me, mistake number 6 is one that almost every guy gets wrong. So, let's get started. But first, take a moment to hit that subscribe button and ring the notification bell. I put out new videos with real medical insights tailored for men over 60 every week. Also, let me know in the comments where you're tuning in from. I always enjoy seeing how far our community stretches around the globe. Alright, let's dive right into the first mistake, which is one that can subtly alter how your brain and body experience pleasure. Mistake number 1. Relying primarily on porn as your main source of stimulation. Over the years, I've had a ton of guys in their late 60s and 70s come into my office and sheepishly make the same confession. Doc, I just can't seem to feel much down there anymore, and I have no idea why. These guys aren't broken. They're just overstimulated. See, once you hit 60, the dopamine system in your brain, the system responsible for feelings of pleasure, motivation, and satisfaction, becomes less adaptable. It doesn't bounce back as fast as it used to. When you're constantly bombarding your brain with high-intensity adult content, it gets flooded with a level of stimulation it was never meant to handle. Clip after clip, novelty after novelty, your brain adapts by essentially numbing itself out. So, even if your physical body is in tip-top shape, your brain stops responding the way it once did. Real, genuine touch starts to feel underwhelming. Intimacy feels distant and difficult to achieve. Pleasure becomes purely mechanical. And the really unfortunate part is that most guys just chalk it up to getting older. But that's not the case. It's dopamine fatigue. It's your brain's way of screaming, I can't keep up with this constant barrage of artificial excitement. If you've started to notice that your sensitivity has decreased or that you're just not as interested as you used to be, this might very well be the reason. The fix is to reset your brain. Take a 14-day break from all visual stimulation. Rediscover pleasure through the sensations of touch, through deep breathing, through simply being present in the moment. Let your body remember what natural arousal feels like, instead of constantly chasing the endless scroll of dopamine overload. And speaking of habits that might seem innocuous on the surface but are actually harmful, the next mistake has to do with where many older men choose to engage in self-pleasure. Mistake number 2, masturbating while sitting on the toilet. I know, it sounds harmless, maybe even convenient. For a lot of older men, the bathroom becomes their sanctuary, their most private space. The door locks, no one bothers them, it's a place where they feel safe and secure. But here's the hidden danger. That hunched-over position, sitting for extended periods, restricts blood flow to your pelvic region. And after 60, good circulation is absolutely essential. Healthy blood flow supports your prostate, the strength of your erections, and when you're compressing those arteries and nerves, particularly while you're stimulating yourself, you're subtly damaging the very systems that keep you healthy and functioning properly. I've seen it play out time and time again in my clinic. Men who develop aches in their groin, experience weak urine flow, dribble after urination, or have chronic pelvic tension, and they never connect it to sitting in that posture for too long. Your pelvic region needs space and movement to stay healthy. So, next time, try to avoid sitting or hunching over. Try standing up, reclining in a chair, or even lying down on your back. Give your body the room it needs to breathe. Your prostate will definitely thank you for it. And if that one surprised you, the next mistake is even more common. It's not about where you're doing it, it's about how fast you're doing it. Mistake number 3, rushing through the experience. One of the most damaging habits I see, particularly in older men, is treating self-pleasure like it's just another chore to check off the list. Let's just get this over with. I hear it all the time. But when you rush, you're sending the wrong signals to your nervous system. Your heart rate spikes way too quickly. Your blood vessels constrict. Your body doesn't enter that calm, oxytocin-rich state that releases healing hormones and elevates your mood. You might reach climax, but your body doesn't actually receive the full benefits of release. Instead of feeling truly satisfied, you just feel drained and depleted. Instead of feeling energized, you just feel empty. Over time, that pattern can actually rewire your brain. Pleasure becomes shallow and disconnected. And speaking of connection, the next mistake involves a part of your body that most guys completely overlook. Yet, it's responsible for everything from sexual control to overall confidence. Mistake number 4, ignoring your pelvic floor. Most men have never even heard of their pelvic floor muscles, but they're one of the most important muscle groups in your entire body, especially as you get older. They sit beneath your bladder, your prostate, and your sexual organs. They control everything from the strength of your erections to your ability to control your bladder. When they weaken, everything above them suffers. I once treated a 68-year-old guy, a retired firefighter. He exercised every day, ate a healthy diet, but he couldn't figure out why his sexual function was starting to fade. The culprit turned out to be a weak pelvic floor. Years of sitting, dealing with stress, and just being generally disconnected from that area had caused his foundation to deteriorate. And when you masturbate without engaging those muscles, or even worse, by pushing down or tensing up, you're weakening them even further. That's why some men experience post-urination dribbling, weaker erections, or reduced sensation down there. The solution is pelvic floor activation. Try this exercise. During arousal, gently contract the same muscles you would use to stop your urine stream mid-flow. Hold that contraction for a few seconds, then release. This will help build awareness, tone, and circulation in that area. With consistent practice, it can help restore both control and confidence. And that brings us to a question that a lot of men quietly wonder about. How often is too often, and how often is not enough? Mistake number 5, getting the frequency wrong, either too high or too low. This is a topic that makes a lot of men feel a little uncomfortable. Some worry that they're well, here's the truth. Both extremes can throw your body out of balance. Too frequent, and your prostate can become irritated and inflamed. Your energy levels plummet. Your body takes longer to recover. Pleasure becomes just another routine instead of a source of renewal. Too infrequent, and you risk stagnation, poor blood flow, nerve dullness, and even atrophy from disuse. The body was designed for rhythm, not extremes. In my experience, for most men over 60, once or twice a week is the sweet spot, especially when done with awareness and intention. That kind of rhythm helps maintain hormonal balance, keeps the blood flowing, and prevents both stagnation and fatigue. This isn't about following strict rules, it's about listening to your body. Because at this age, your body speaks softly, and your job is to pay attention and hear what it's trying to tell you. But even if you've nailed the frequency, there's still one mistake that can silently undo all your progress. And that's the next one, the one that most men never even suspect. Mistake number 6, using too much pressure or force. This is one of the most damaging, yet most overlooked habits among older men. As sensitivity decreases with age, the natural inclination is to press harder, grip tighter, or use rougher surfaces to compensate. But that instinct can seriously backfire. The nerves in the penis are incredibly delicate. Years of excessive pressure can lead to microtears, scar tissue formation, reduced elasticity, and even curvature of the penis, a condition known as Peyronie's disease. I've seen men who have slowly lost feeling down there, not because of age itself, but because of the trauma caused by too much friction and force. And that tension actually blocks the very circulation and hormones that are necessary to create genuine satisfaction. So, be gentler with yourself. Your body responds far better to patience and care than it does to punishment. And that leads us to the final mistake, which isn't physical at all, but rather emotional. And it might just be the most powerful one of all. Mistake number 7. Masturbating without emotion, connection, or intention. This is the one that breaks my heart the most. Over time, a lot of older men stop feeling connected to what they're doing when they engage in self-pleasure. It becomes just another mechanical routine, quiet, joyless, and empty. They're not doing it for pleasure anymore, they're doing it out of habit or because they're feeling lonely. But when masturbation loses its emotional component, it also loses its potential to be healing and restorative. Your brain stops releasing oxytocin, the connection hormone that eases anxiety and promotes feelings of happiness. Dopamine no longer replenishes your motivation and drive. You might still reach climax, but you'll probably just feel empty afterwards. And that's not because of your age, that's because of disconnection. Even solo touch can be something sacred. It can be a moment for gratitude, a way to reconnect with your body, your breath, your own vitality. Touch yourself not as a way to escape from something, but as a way to reconnect to something, not just for release, but for renewal. Your body is still yours. It can still feel. It still matters. And when you bring emotion and mindfulness back into that space, your entire nervous system can heal in ways that modern medicine can't even measure. Now that we've covered all 7 of these common mistakes, let's bring it all together into some simple, practical steps you can start taking today. Cut down on visual overstimulation. Change up your environment. Avoid the toilet. Opt for a relaxed, reclined position that promotes healthy circulation. Slow down your rhythm. Treat the experience as a form of relaxation, not as something you need to rush through. Engage your pelvic floor muscles. Gentle contractions can help build control and awaken dormant nerve pathways. Find your natural frequency. Aim for once or twice a week, done mindfully, to support both prostate health and hormonal balance. Use gentle touch. Always prioritize healthy blood flow and comfort over excessive force. And finally, reintroduce emotion. Gratitude, conscious breathing, and a sense of connection are some of the most powerful performance enhancers you can find. If you've made it this far, I want to speak to you, not just as your doctor, but as a woman who has spent over a decade listening to good men struggle in silence. You are not broken. You are not past your prime. You are simply evolving. Your body is asking for a different kind of attention now, one that's built on awareness rather than just habit. And when you give it that, everything will change. Pleasure will return, your confidence will be restored, and your connection with yourself or with a partner will begin to feel truly alive again. Aging doesn't mean the end of vitality. It just means a shift in how you relate to your body. So, slow down and rediscover your curiosity. Your body is still talking to you, you just need to take the time to listen. If this video has been helpful for you, please give it a like and share it with another man who needs to hear this message. And don't forget to subscribe to my channel. I'm Dr. Nerita, and every week I'm sharing real medical insights